ABFM Family Medicine Certification Longitudinal Assessment, or FMCLA as we call it, is a pilot exam alternative. It gives physicians the ability to take their exam in a time and setting that they choose rather than going to a brick and mortar test center. The longitudinal assessment approach benefits diplomats because it lets them take questions at a time and place of their choosing. It provides immediate feedback as to whether or not they get the question right or wrong, provides information about why the right answer is the right answer, and references as to why the question was even being asked and the evidence that supports it. Now that we're about 6 months out, we're trying to gather information about people's perceptions about the program as a whole and if they're preparing differently than they did in previous iterations of their exam. The feedback we've received on the pilot program thus far has been very positive. Greater than 90% of the physicians who are participating in the program appreciate the changes that we're making, appreciate the platform and the program as a whole.
MOCA-Peds is a web-based platform. It's a learning assessment as well, where pediatricians will get a series of questions every quarter that they answer, and it is delivered via a mobile device or a computer, and it is a continuous assessment rather than being a point-in-time assessment.
So the MOCA Minute project was initially a pilot project that became a permanent component that all diplomats of the American Board of Anesthesiology participate, all comment on its positivity, and really enjoy the fact that it is extremely relevant to their practice and advances anesthesiology. The project does require a lot of questions, which means that we need to tap into several areas. So one of the things the American Board of Anesthesiology explored was the ability to collaborate with the subspecialty societies. The American Board of Anesthesiology benefits from getting questions that are very current and relevant, while the society benefits by that it can generate content as well as increased visibility on its part. The diplomats benefit by receiving up-to-date knowledge, and it ultimately is the patient who benefits from this improved knowledge.